my name is Emma Wood and I live in the Highlands of Scotland, and I teach privately and I write books. That's my main things that I do. And obviously it requires good brain power to be able to do that. And over the last 2 or 3 years, and particularly in the last year, that's become really, really, really difficult. Where it used to be not completely easy, but it wasn't anything like as hard as it was now.
And explain what your main condition is as well.
My condition is, we thought it was multiple sclerosis, and that's all it was. And that was based on based on all sorts of diagnostic decisions made by GPs and specialists, and also based on blood test results. And all those things were wrong, which is obviously terrifying, because when I'm not a great fan of medical things, so when you finally go medical, you think, well, at least I'm going to get some sound information. And on all sorts of levels, in particular the blood tests, they were just wrong.
So you do have MS, but lots of the symptoms you've been experiencing at home, which were severe spasms, poor mobility, confusion, not feeling yourself.
And I think it was not just those symptoms, but the fact that they were so awful. So, what do you say, strong?
Severe.
Severe, that's it, yeah. And particularly, for example, strong spasms. That was the first thing that Dr. Igor, God bless him, noticed
When you got here.
When we got here. And he immediately thought, no, that's not MS, because those symptoms are too strong. And I had my spasms tested right from the very, I've had this disease for nearly 30 years, and that's what they always test, is the spasms. And I often say to myself when I go for a checkup, these are stupid, there's nothing they can do about it. They know that it's going to be spasms, so why did they even bother testing them? This was why they should have been testing them. And this is where we patently failed to come up with a result. And I had 2, 3, 4 different specialists over these 30 years, and none of them have picked this up. And the minute we got here, Dr. Igor immediately knew that this was not just MS. And I think he said he immediately thought it's got to be checked, and he thought it was likely to be Lyme's. Is that right?
I'll explain the next bit, because when you got here, you were very confused.
Oh, when I got here, we'd had a long journey, we'd been up all night.
You also were unwell.
But I was unwell anyway.
So we've been in touch with the doctors at home about all these different symptoms, and they told us again it was just MS, it's just MS. This is what you should expect from MS.
And said things like, can I interrupt but just say this, because this broke my heart, you can imagine, when they said, what do you expect, especially at your age, because I'm nearly 60, what at your age with this disease, nothing you can do, you just got to live with it. So which is pretty awful. Pretty awful. On you go.
So when we got here, the first thing the clinic did was do lots of diagnostic tests, and they identified that there were 4 other infections present, which were drastically making the MS worse, and lots of the symptoms you had been suffering were actually not MS. So they very quickly managed to establish that and treat it within the first couple of days of us being here, and you immediately started to feel better.
Oh, absolutely.
And a lot clearer.
A lot clearer. I couldn't have agreed to give you this interview
2 weeks ago.
Safely, 2 weeks ago.
Yes.
You would have wanted it. And I'm still a wee bit, I'm having to say to Jasmine, words for those things. but not anything like so much as what I was, thank goodness.
But we've been really impressed with everything at the clinic since we've come so far.
Totally.
All the staff have been very knowledgeable and caring. The communication has been really good.
They've been so kind, on every level.
And you've been given choices at different points and options in your treatment and timings and when things will happen. So again, that's communication.
On the door. It's a little thing. It makes all the difference. And we've talked, yes, communication is really good. And the way the staff interact with each other, I find really moving as well as effective. And we were, and Jared, you didn't want me to say this, but it's like really, absolutely, I loved it. When I was having my second procedure yesterday, and they were folding up towels, and I think it was almost Dr. Eagle, somebody as high up as him, and a very ordinary, lower down the scale person, folding up a towel together. And it's that sort of egalitarianism, which is so wonderful. I don't know why I find that so impressive. But I just think it means everybody's got their shoulder to the wheel, if you know that's English expression.
And I think we were really impressed with, if we'd been at home, if we'd wanted to get all these tests, we've had MRI scans, several tests, and lots of different procedures carried out. And if we'd been at home, that would, I think I worked out, it would have probably taken almost 2 years with waiting lists, waiting to get tests back, waiting for new appointments. And it's been done really quickly and efficiently, and the level of care that's been provided has been excellent.
Let's just check.
Hasn't it?
We made a list. Let's just check. I think we've more or less covered everything. You must probably have other questions to ask, but let's just check. You tell me. You check as well, darling.
The accommodation, the food. Do you want to say about that?
Oh yes, talk about the accommodation. It's great.
But think about, we're trying to think of things for people coming here from the UK. What would you say to people who are maybe anxious about coming to a different country for treatment?
I would say absolutely no problem with communication. I absolutely trusted everybody. I felt from the bottom of the hierarchy of people to the very top, I felt that you all cared so much, and also that very often there's sort of when the staff say horrible things about each other, and that immediately throws your confidence in them, and that happens a lot at home, doesn't it? Well, it does to me. Have you done that? Have you found that? Yeah. Anyway, I have. Whereas here, everyone just really admires everybody, upwards and downwards, and that makes a massive change. So that is something I would think would be a reason to come. And also the fact that they know what they're doing. And alright, so Big Vlad, right, who isn't even necessarily, he's the head nurse, so he's important, has just come in now and given me a real good talk about how I'm on the verge of getting a bed sore on my back, and not just saying that is the case, but giving me tips of how to make sure that it doesn't get any worse, and saying what awfulness it would be if I'd let it get worse. He just drops that in, just while he's doing something else, like he's determined not to let me go out because we're off tomorrow without telling me that. And there's other things like that, but it's just happened, so it's fresh in my mind. Just perfect, an important thing. I don't see that happening at home.
I think it's the best level of care we've experienced.
I've never experienced anything like this ever.
Everybody that works here is
and utterly committed
and devoted to getting you better.
Oh, I know what we haven't said. we said communications, but what I absolutely love is when 8:30 in the morning, everybody comes and sort of in a row, and led by Dr. Igor, and tell me what's going to happen. Each day, every day. And that in itself, you know what your day is going to be, and they give you options, so you know what your day is going to be, and that has been shaped by you, obviously mainly by the doctors, but you've got your all in to say maybe the order you want things in, or whether you do want something or you don't want it. And again, that's something we're completely unused to. Yet it's not a big deal. It's not that difficult. Really, is it? There's so many of these things we're telling you. I mean, I keep saying, it's just because it's a private place. And to some extent that's true. But it's not impossible, and it's not, most of these things, they're not going to cost anything, or much.
I don't think we could recommend it highly enough, could we, to anybody that's coming?
No, honestly, don't panic. Serbia, by the way, is not the place that it's being painted, or has been painted, since 1914. The kindness of everybody I've met, even out of the clinic, when I went for my scan, my MRI thing, first one I've ever had, so I was very, nervous. They were totally kind and totally determined that I should be comfortable, and kept asking me, is this okay? Are you comfortable? Do you feel happy? And letting me know exactly how long it would take and what it was going to involve. And I was thinking I would panic like mad, but no, I was made to feel I was given all the information at every level, and in those places as well. And I felt that was very much because, I may be wrong, but when they knew that I was coming from here, I think that made a huge difference everywhere I went.
And there's the option to stay in the clinic, or you could come in every day. But I think that staying in the clinic is a great benefit because you have access to a doctor and a nurse 24 hours a day.
7,
which makes you a lot more relaxed and you feel a lot more calmer and safer, especially when you're having treatments done that you maybe haven't experienced before.
No, of course, a lot. I've been an amateur one for the last 20 years and haven't had 5 minutes off. So we've decided I would go for a year's sabbatical, and this is a great way of telling people all this stuff rather than putting out in publicity, which was my plan, writing articles and getting them published. This is what I'm going to do. So I'm afraid I won't be doing that at home, but anyone who's not sure if you can possibly afford it, and that's the final thing, we couldn't afford it when Jasmine found it, but we fundraised on the cloud, crowdfunding, and because it makes such a good impression, when we described what we were being offered, we were able to raise the money relatively easily. Well, there's will you explain the sponsorship? Is this appropriate to tell you about that now?
Well, you have explained it, crowdfunding.
We've squashed everything into this tiny space. That is quite demanding, but it's good because things get done, as Jasmine pointed out. It all comes in a one-up. And the brilliant thing is, we go home, but it's not over. Mm-hmm. If we can't afford to come back, or if we can afford to come back, I can get in touch with you
Of course.
whenever I want, and if I can't come back, or even if I can come back, we can Skype,
Yeah.
and we're going to be you're sending us home with all what I need to do,
Yes.
the medicines I need to get.
And the big thing for you going forward is to get, in this 2-week period, while you've had all the procedures necessary, the next thing for you is physiotherapy, which is something that we need to continue at home.
On the right sort of physiotherapy,
Mhm.
not just any old physiotherapy.
Yes, yes.
To rehabilitate to walking.
But already,
And of course to keep us informed how everything
How
is
we're
going
going.
on and the improvements. And
yeah.
Because the feedback is also very important for us, and we insist on
And of course for
in
me,
contact with patients.
of course for
after
me.
treatment.
For me.
This was a very detailed interview, so
Thank you very much.
thank you.
I hope that was okay anyway.
Of course.
And they, the following day, had telephoned the house and said that they had a lady in there that had stem cell transplantation, and would I like to speak to her. After speaking to the lady in Serbia, I could tell in her voice how wonderful the care that she'd had, and I realised it wasn't a scam, and there was nothing to lose. I just needed to book a plane and go.